Okay, so the next session is applying Outbreak lessons learned to strengthen food safety improvements. So I'm Raquel Mamer. I work at General Mills and managing global regulatory compliance. And so this session is going to be about 90 minutes. The second half of the session, we're going to be having a conversation talking about root cause analysis and information sharing and trying to tease out some of those things that we've learned in the past and that we can kind of apply to the future. But before that, we are going to have an opportunity to listen to Frank Yiannas. And so many of you likely already know Frank, right? He was the former Deputy Commissioner of Food Policy and Response at the FDA. Now he is kind of on his own with Smarter FY Solutions. But prior to the FDA, he was the VP of Food Safety at Walmart. Prior to that, he was the Director of Safety and Health at Walt Disney World. But what I will also tell you, in order, especially for the people that are kind of early in career, way, well, not that way, but sometime before Walmart, he started off as a third shift quality and sanitation person at an egg facility. So this is somebody who's had boots on the ground, has had all these different experiences, and has used all those experiences to really have a lifetime of advocating for food safety. So please help me welcome Frank up to the stage.
Thank you.
Thank you.
Is there an advancer up here? Okay. You didn't tell them that child labor laws were different when I started. But yeah, a lot of people don't know that. It started third shift sanitation at an egg processing plant in Bartow, Florida. And I can't tell you how many tankers I had to get inside and clean and sanitize. And so that's how it started for me. What a pleasure and honor to be in front of AFDO. I mean that very sincerely. Steve, AFDO team, thank you for the invitation over the course of my career. It's been a lengthy one, as you heard, 38 years. Whenever I've gotten an invitation to be at an AFDO meeting, it's been an easy yes. Why is that? Because the important role that all of you play, in particular the states, in our nation's oversight and federal food safety system. And so, honor and privilege. I was asked to talk to you a little bit today about how do we apply the lessons learned from outbreak investigations to further strengthen preventions, to prevent foodborne illnesses from happening over and over again. And you can see I actually headed it with rethinking food safety. Since I left federal service about 2 years ago, there's 2 phrases I've been using a lot. It's time to rethink food safety. And I've also said, it's time for us to have some straight talk on food safety. I can do that a little bit more freely because I no longer work for Uncle Sam. I'm on my own. And I want to draw a distinction. There's a difference between destructive criticism versus constructive criticism. So I'm going to be challenging today. I'm going to be provocative intentionally, but it's not intended to be destructive. It's intended to be constructive. You heard a little bit about my background. I've spent 38 years in the private sector. I started my career at the Disney company. Ended up overseeing everything safety and health. I mean, food safety, occupational safety and health, attraction safety, guest safety. And I actually quite like working for a mouse. How many of you been to a Disney theme park before? All right, for about the 5 of you that didn't raise your hands, I'd like to see you after my presentation. Shame on you. I then left after 20 years working for the Disney organization and joined the Walmart organization. People said, why would you leave the Disney company? It's such a fabulous company. It's known as being world-renowned. Why would you leave? And I went to Walmart. People don't realize 1 out of every $4 spent on food in the United States is spent at a Walmart store. So if you want to make a difference on food, that's a pretty good place to be. And by the way, a mouse was a very good thing at Disney. It's not such a good thing at Walmart, I found out. And then after 10 years, told my wife, Diane, well, Diane, this is where we're going to retire. This is where I'm going to spend the rest of my life, Walmart. I really like it here. Ended up going to FDA. And what happened there, I like to say there's 2 types of commissioners at the FDA. There are celebrity commissioners and regular commissioners. Most of them are regular, not celebrity. But I started getting calls from a celebrity commissioner by the name of Scott Gottlieb. How many of you know the name Scott Gottlieb? Okay. I like to joke, if you had dinner with Scott 3 times, breakfast once, he'd convince you to take a 50% cut in pay, move halfway around the country, and end up working for your federal government. But what an honor and privilege to have served as deputy commissioner from 2018 to 2023. I'm going to try to apply some lessons learned from what I call a balcony level view, the world's largest company and one of the world's most important regulatory agencies. And this is the question. I don't think I've asked it at an AFDO general session. I've asked it at an AFDO workshop, but I ask this question every conference that I go to. All over the world. Since I've left FDA, I've been to New Zealand, Australia. I've been to several European states. I've been to Japan, Southeast Asia. This is a question I love asking. Are we winning the battle against foodborne disease? You guys need to participate. Shout out a little. You hear that, Steve? No, resounding. Not even some lawyers in the room that says, it depends. Steve, that's you? No. Now, I told you I'm going to be provocative. That's quite concerning. Some of the smartest men and women in the profession who have been at it for a while, I say, are we winning the battle against foodborne disease? And the first and loudest answer is no. And that's the same response I get. It doesn't matter what continent I'm on. Why do you feel that way? We've won many battles, haven't we? Over the 20th century, we did. But if you look at the battles that we're facing now, they're different. I got this slide from Art Liang, who retired from CDC last year. We all know Art and love Art. So many heroes retiring from CDC. He said, these are the pathogens we were concerned with at the beginning of the 20th century. We're in the 21st century. What pathogens do you not see on this list? E. coli. You don't see E. coli? Listeria. Vibrio. Most of the bugs and challenges, you don't see the chemicals of concern. You don't see PFAS on there. So the battles that we face are different. And that means that the tactics that we use have to change too. This is another reason why we don't feel we're winning. If just look at the headlines. I make my living now being an advisor to companies that are having problems. And I don't know about you, towards the end of last year, I could not keep up. I would have to wake up every morning and say, what recall, what outbreak? And it's starting to feel that way again. Huh? Can't keep up. These are just a few of the headlines. My goodness, are we winning the battle when we're intoxicating children in the United States, the most powerful nation in the world, with lead? Are we winning the battle when we're having deli meat outbreaks again? And it resulted in 10 deaths, not 9? Are we winning the battle when the Golden Arches, one of these mega companies, most prized possession, their quarter pounder, results in not only illnesses but a death? And how about recalls? I had to throw this one in here real quick as we set this up. How many of you seen this study published in the Journal of Food Protection? 21 years of recalls of FDA-regulated food products. I did the math, over 35,000 recalls. The number one reason for recalls? If I asked you, most of you would say allergens. According to the study, what I did was I didn't say just allergens, just like you wouldn't say bacterial. I said, what type of allergen, what type of bacteria? And the number one, with specificity, the number one reason for recalls was listeria. And boy, is listeria rearing its ugly head today with vengeance. And guess what? It's only going to get harder as the age 65 plus doubles every decade or so. And I did the math, that equals approximately, well, they didn't occur normalized over time, about 5 recalls per day. And I can remember last year waking up one morning, an early riser, wake up every day around 5 o'clock in the morning without an alarm clock. And I had just read a few articles where the press, they contact us, as you know, once these stories and recalls start appearing in the news. And they started talking to some colleagues that I respect that said in these interviews, recalls are a sign that the food system is working. And after about 4 or 5 of those articles, I just couldn't take it anymore. And I woke up and wrote my first Straight Talk article, which are recalls a sign that the food system is working? It's a reactive measure. It's like breaking the glass to get the axe to fight a fire. If you've studied Edward Deming, what do you know? You're seeking process control. A recall is a sign that your processes weren't in control. And then recent surveys last year from a very credible polling organization, Gallup. Trust in the government's ability to produce safe food or oversee food safety is an all-time low. And then we'll end it here and we'll start pivoting. I love this quote from Deming as well. In God we trust, all others bring data. And when people want to debate whether we're winning or losing the battle against foodborne disease, I say just look at FoodNet data. And you guys know the story here. It's the incidence of foodborne disease per 100,000 population. We know that we do aggressive surveillance in a large portion of the US population. And I just ask you to pick your pathogen. Look at green. At 1996, it looks like there were about 15 cases of salmonellosis per 100,000 population. And what's the number at the last 22 year of reporting by CDC? Same number, a little bit higher. Look at CAMPI, same number. Pick your pathogen, and what does the headline say if you interpret the data? Progress against foodborne disease has stalled. When I was in federal service, I talked about the need to bend the curve of foodborne illness. We have not bent the curve of foodborne illness for most of the pathogens of concern for over 20 years. Straight talk. So I've been saying, and I can't think of a more important time that at any point in my 38 years in the profession, it's time for us to really pause and rethink what we're doing and how we're doing it. Why? Because rethinking is important. This is the definition for me. It's to think again about the assumptions that we're making, the plans that we're using, the models, approaches, and systems. And again, it's ultimately constructive, not destructive. And why do we have to rethink right now in the year 2025? Because to not do so means what? We're going to do the same things, and what's the definition of insanity? And it also means that, guess what? I don't want to go another decade without meeting our Healthy People 2030 goals in food safety. I saw us miss the 2010 targets. I saw us miss the 2020 targets. I saw us miss the 2030 targets, or we're about to, I believe. And I don't think we have to miss them. If we all collectively say, we're smarter than this. We know we can do this. What do we need to rethink? Real quickly, we're here to talk about outbreaks, but I'm going to tell you just a couple, and we're going to pivot and spend the rest of our time on outbreaks. One is I think we need to think about how we do hazard analysis and risk assessments. It's time for us to modernize HACCP. I oversaw attraction safety, occupational safety, and health. I don't know too many professions that use the same risk management model or paradigm for 50 years. It's time to modernize HACCP, and it's time for us to consider and think the difference between a hazard and a risk. They're two very different things. And the outbreak suggests that. What happened in Wanabana? If you look closely at their food safety plan, they didn't identify lead as a reasonably foreseeable hazard. Poor risk assessment. This is a new slide I created a couple of months ago. You can critique it, you can change it, you can use it, but I want us to start thinking about the controls that we're using. In fact, I'm more convinced that this idea here right now is a big idea. We have a lot of controls. How many of you, I review food safety plans every week. I see controls everywhere, controls a gazillion. But most of the controls, guess what? They're terrible. Teenagers would say they suck. They're really poor. And so I want us, and why is that? Today's food system is very labor intensive. It requires people and humans to do the right things at the right time. It's not all automated. Now, things might change with the labor shortage, and if we have a seat at the table with the wave of automation that's coming in, maybe this is our one best hope to really bend the curve of foodborne illness. But what I see is, in this hierarchy of controls, the food system remaining down at the bottom of that pyramid for decades. meaning our controls are really dependent on people to execute at the right time, at the right place, every day, even when they're having a bad day. You can strengthen those controls by moving up this hierarchy, by reformulating, by creating engineering solutions. And elimination, well, sometimes you can, but you can't do that for everything, right? Why do you think we continue to see outbreaks with deli meat? Because we're still relying on administrative controls, and over half of the industry, believe it or not, you can quote me, over half of the industry is still at alternative 3. What does that mean? A reliance on sanitation to prevent recontamination. By the way, these deli meat outbreaks aren't because the deli meats aren't being undercooked. They're being recontaminated. And what if you actually adopt this model that Yiannas is talking about? You can see alternative 3, an administrative control with this qualitative and quantitative risk assessment. You can see the total number of illnesses projected in the United States. If you go to Listeria mono and deli meat with growth inhibitors, remember I said you could reformulate, that's a better control. You reduce the number of cases, but what if you go to water pasteurization or high pressure pasteurization, an engineering solution? You almost eliminate the risk totally. So let's spend some time thinking about the controls. And how about sanitary design and environmental monitoring? How many of you adopt the mindset seek and destroy? I'm going to ask you to change your mindset. It's not seek and destroy. We now know it's seek, find, understand, and eliminate. Seek and destroy is you're going to look for positives, you're going to get the positives, and you're going to pour a shitload of sanitizer on it, and not do a good root cause investigation to figure out why the bug was there in the first place. Why do you think we have problems with recontamination, whether it's Chronobacter and Listeria? I think the seek and destroy mindset was good at its time, but we need to go much further than that. But we're here to talk about rethinking how do we use foodborne outbreaks to get better. We have to use foodborne outbreaks to get better. Why? I think there's a big difference between knowledge and experience. Anybody, what's the difference between knowledge and experience? Knowledge is knowing what to do. Experience is knowing what to do because you've learned lessons through trial and error, what's worked and what hasn't worked. And I'm going to suggest to you, and being a student of the behavioral sciences, you don't have to just teach knowledge. Regulators love to teach knowledge. Good teachers teach experience, which is this is why you have to do something, because if you don't do this, this could be the consequences of it. And what I have found, because we're not doing a good job teaching experience to food producers that have not had an outbreak or recall, we have a large section of the food and ag sector that's becoming complacent. What's complacency? Well, I used to tell people, don't become complacent. When I was FDA, I'd say, don't become complacent. At one point, I got frustrated. I said, well, let me define what complacency is. And I went to Webster's dictionary, and this is a definition that I really liked. A feeling of quiet security while unaware of some potential danger or defect that lurks ahead. Now, I worked for an entertainment company, and Walt Disney taught me that pictures are the best form of communication. This is what complacency looks like. This might be your company on the left coming to the well every day to drink because you're producing a product and making money. But little do you know that next week or tomorrow, something's going to eat you for lunch, whether it's that Listeria recontamination event. And that didn't satisfy me. So I thought about my tenure at FDA, where I was responsible for food policy and response and worked weekly with the core foodborne outbreak investigation team. I thought about the many recalls that I executed when I was in the private sector, working for the world's largest retailer. And I'm starting to create this idea. I'm going to probably turn this into a research study. But what does complacency mean in the food sector? What does it really mean? Because it's easy to say, but what does it mean? And I'm starting to come up with what I think could be a formula to complacency. One is I find these companies that have had the outbreaks and recalls have been a bit overconfident. We've always done it this way. We've never had a problem. Why should we change? I already convinced you they've done inadequate risk assessments. I've already convinced you that the food system is full of ineffective controls. And then my favorite, whenever I get called in and I sit across the desk from a CEO that's just had a crisis, they always tell me, but my food safety team was telling me I was performing well. All of our scorecards were green. These are the mistakes of others. And there's some brands up here that's not to pick on them, it's to learn from them. What happened to Foster Farms? Does anybody remember their salmonella outbreak? Salmonella Heidelberg? They managed to reduce salmonella contamination on whole carcasses, get it down to less than 1%. But what happened to the chicken industry? Nobody was buying whole birds. I saw that at Walmart. Shelf space for whole birds shrunk. Shelf space for chicken parts grew. And what happens when you take a chicken carcass that has less than 1% salmonella and start chopping it up? It rebounds back up to 25%. Measuring the wrong things, and the regulations, in fact, not keeping up with it. How about Bluebell? A company that had been in existence 108 years, never had a problem. Boar's Head. I think many of you know I'm serving as an advisor to them. A company that's been in existence for 119 years and never had a problem. You think that might lead to complacency? I already gave the example Wanabana. And how about powdered infant formula? Recontamination. What are the lessons learned? So let's pivot to what we have to do to apply the lessons learned through outbreak investigations to prevent. This is my second question of the presentation. These are the two big questions. Are we winning the battle? Your answer was no. Here's my second big question. Are our current foodborne outbreak detection and investigation processes achieving these? A, better and earlier detection of clusters of related illnesses that maybe in the past we didn't know were related and we thought were sporadic. B, more rapid and confident identification and removal of the responsible food vehicle. In essence, that would be a form of prevention. We would call that secondary prevention. C, are they resulting in thorough investigations of identified root causes and the contributing factors? Are they resulting in us disseminating that information and the lessons learned to similar regulated industries and other stakeholders to prevent reoccurrences? Or all of the above? I didn't have time to turn this into an electronic survey, so let's just do this the old-fashioned way. Which letter do you pick? Heard B, E? You think all of the above? Anyone else? A? Anyone else? Don't be shy. E. B. I am not at the E camp at all. Yiannas votes an A. And we need to have all of these. It needs to be an E. Let me make the case. Is it resulting in better and earlier detection of clusters of related illnesses? Absolutely, yes. We know the whole genome sequencing has more discriminating power than pulsed field gel electrophoresis, and we are seeing cases, sometimes single, isolated cases in multiple states. We know there's something in common. And what do we hear from CDC and other health officials? That, yeah, we're detecting more outbreaks, but they're smaller in nature. So I think, it's really been dramatic. WGS has done a lot, but we're not done yet, folks. It's achieved A. Has it achieved the rapid removal of contaminated foods from the marketplace? Well, we know in this lettuce outbreaks it hasn't, right? This is a chart of a representative epidemic curve, and you can see WGS allows us to detect the clusters, but we got to find the food, right? We might know it's leafy greens, but what brand of leafy greens? And if you think, oh, Yiannas, you're still hung up on the 19s and 20s, I went to the core outbreak tables, which is something that we started while I was there, a policy change that we made at FDA while I was there that said we will tell the American people the outbreaks that we're investigating, and another policy change that we made that was recently published that said, and even if there is no actionable information for consumers, we're going to tell the public of an outbreak that we investigated. But FDA closes these outbreaks, and so far in 2025, and I'm going to condition what this data means, these are outbreaks that the FDA investigated and closed so far this year. What do you see under that column, products linked to illnesses? How many of you pay attention to this? Good, a lot of hands going up. I'm fixated on this. How many times there's outbreaks being reported and we know the clusters, WSGS is achieving A. Is it achieving B? No. Because guess what? In any of these outbreaks here, we don't know with certainty what was the food vehicle that caused the illnesses. Now, if you look for the entire year, 24 and 23, the outbreaks that didn't have a vehicle identified, it's not going to be as high as 20, but it's going to be a high number that's going to leave you unsatisfied. So I like to use the analogy, WGS in and of itself alone is not good enough. And I use the analogy, it's the equivalent of finding the needles, but we can't find the haystacks. We can find the needles, but we can't find the haystacks, the foods that are causing the illnesses. And just like we've applied technology to be able to find the needles, we need to apply technology to be able to find the haystacks. Is it resulting in thorough investigations and root causes and the contributing factors and disseminating those lessons learned to others? Well, you tell me. These are a string of recent outbreaks. Cantaloupes, again, 15 deaths in Canada and the US. How many of you remember the plant-based milk recall and outbreak from last year? Any of you know really what happened in that plant? If you do, tell me. Boar's Head, do any of you really know what happened? McDonald's, do we know how those onions became contaminated? Are we certain it was the onions? The epi suggests it was, but are we certain? And do we know how those onions became contaminated? And the last one just makes the point perfectly clear, doesn't it? Cucumbers, again, same grower, last year, this year. I'll be a little bit more dramatic and really beat this one over the head. And this is with all due respect. I love the men and women at the Canadian Food Inspection Agency, but this was the plant-based milk recall. When it was all said and done, this is on their website. It said, statement on the conclusion of the food safety investigation related to the Silk and Great Value brand outbreak. CFIA is saddened, of course. We all take the loss of life and illnesses seriously. But here's the investigation conclusion. The investigation was not able to confirm the primary source of the contamination, which is not uncommon. And then, of course, the company is required to follow federal laws. How does this make you feel 2024, a respectable regulatory agency, and this is the kind of investigation we get in an outbreak? Very unfulfilled. I love the FDA, I still bleed blue. I'm not happy with what's happening. What happened with the McDonald's outbreak? Colorado Department of Health and others collected samples. FDA found one onion sample that had an E. coli in it. It wasn't the outbreak strain, but the epi suggested it was the onions. What do you learn there to prevent it from happening again? Anything? And this one really fired me up at the beginning of this year. First of all, this was a pretty significant outbreak. Shakes, 14 deaths, no outrage, no reporting on this by the media. And read the conclusion there. CDC declares outbreak over, FDA investigation is complete. At this time, no recall products should be available. and it doesn't tell you anything about how the contamination occurred. How are we supposed to prevent these outbreaks from happening again if this is the responses we're getting from federal agencies? So if I asked you the question again, how do you answer this? A, B, C, D, or E? And how do you rate it? I would say there's still a lot of work for us to do. So I'm going to end with this. Here's the call to action. I'm running good on time. We have to further strengthen federal and state outbreak response investigation and coordination. We have to do better root cause investigations on these outbreaks. Just responding to an outbreak, pulling product from commerce, and preventing additional illnesses is not enough. And unless we do that, we're not going to inform future prevention. Sometimes it works. This is the Boar's Head outbreak. This is the epidemic curve straight off of the CDC website. And I do want to thank the states, because I can tell you when I was in federal service, time after time after time, the states actually pulled the rabbit out of the hat. What happened in this outbreak? Maryland pulled samples from retail of deli meats, and lo and behold, they found Listeria in Boar's Head liverwurst, a type of deli meat. They found that on 7/26, they reported Boar's Head. On 7/26, Boar's Head pulled liverwurst. A few days later, they said, guess what? Not only was it El Mono, but we have the genetic match. What we found in the product matched the illnesses. And they expanded the recall. You can see this is the public health system working, right? Can you imagine? Oftentimes we see Listeria outbreaks, and what do we see? Multi-year outbreaks of a resident strain. This outbreak could have been so much work, but this is the public health food safety system working, and working largely because, thanks to the great work from the CDC in the states and the wonderful lab work from Maryland, and eventually a couple other states found it as well. But we got to continue to make investments. And in a time and day when we're making cuts to states and we're making cuts to FDA, that's concerned. So we all need to advocate to further strengthen federal state outbreak response. Let's continue to do root cause investigations. Let's learn what a root cause investigation is. And when you go in to do an investigation, go big. I can't tell you enough, go big. Can't tell you how many times, if there's anybody from FDA and CORE in the audience, they'll know how many times Deputy Commissioner Yiannas said, well, guess what? You're going to go back and take more samples. Any of you like the murder mystery shows? Anybody watch Forensic Files? Who are the greatest investigators? They're the ones that are persistent, right? They dig hard. In fact, when I was at FDA, I asked people, do we have a procedure to do a root cause investigation? And I used to tell the commissioner, if you ask 5 people at FDA, what is a root cause investigation, you'll get 5 different answers. And I hope by now we have an SOP, because when I was there in 22, we didn't have an SOP on how to do a root cause investigation. We called them environmental investigations. Number 2, WGS alone isn't good enough, so we have to improve traceability and principles of infodemiology. What do I mean by that? Let's start off with traceback. You all know the 3 legs of the outbreak stool. The epi alone isn't going to cut it. If we can get the traceback, that's going to be wonderful. But you can see, at least in the outbreaks that FDA investigated in 25 and already closed, we didn't find the food vehicle in 80% of them. And if we can find micro, that's golden, right? Don't let FDA's delay of the food traceability rule, which I was not happy about, slow you down. If you're working out there in the private sector, it should be full speed ahead, because this is what's right for the food system, what's right for your customers. And infodemiology. You know, we often have to rely on people's memories of what they've eaten. Increasingly, the data is suggesting, you know, we can have electronic records of what people have eaten, both through loyalty cards, through online purchase habits. You increasingly can triangulate, maybe without real traceback data, but get firm association with what was the most likely vehicle consumed by those that became ill. Third, demand root cause investigations and transparent outbreak reporting. You have to demand it. You have to demand it of the agencies that you work for. You have to demand it of your federal government, but demand that we do better root cause. I was so pleased to see how many hands went up when you said you're looking at that outbreak table and you're seeing that, hey, the vehicles are not being identified. What the agencies are doing now is not acceptable. They're posting these advisories and giving updates that have no detail. It used to work a little differently, AFDO. On outbreaks of concern or of significance, we would insist that we write an outbreak investigation report. How many of you remember the outbreak investigation reports? They were very insightful. And while sometimes people would take shots and say, Frank, it wasn't written great, we were getting better as we went. Remember the Romaine outbreak in the fall of 2019? We put maps of where the tracebacks and where were the farms. We put markers on where we found the outbreak strain in the environment. How about red onions? Any of you read the Thompson International report? A lot of pictured maps in there and what we found, the number of positive samples that we found, how many samples we took, how many were Newport. Remember that outbreak was the largest salmonella outbreak in over a decade caused by salmonella in Newport. And while we didn't find the outbreak strain, we found at least 3 other strains of Newport. And by the way, we even in that report, I remember put our leading hypothesis. I remember forcing the scientists to say, well, put your leading hypothesis. How do you think it happened? And how many of you remember the Bright Farms outbreak in 2021? A controlled environmental agriculture indoor lettuce producer. That whole sector and industry was saying, we don't have the problems that the outdoor growers have, right? How many of you read that report? And guess what? The company thought their ponds were clean. We insisted, and when you go and do thorough root cause investigation, I said, go big, think differently. Sometimes you have to use methodologies that are not in BAM. It's an investigation. It's not a routine sample. We did high volume filtration, and guess what? We found salmonella in the ponds. The company couldn't find it because they're doing 100 mil grabs. We need to get back to these types of reports. And we need to incentivize, if we're going to really use the lessons learned, we need to incentivize industry to do it. So yeah, I'm speaking primarily from the vantage point of a previous regulator, but I've worked in the private sector and I get hired by the private sector. And guess what I've concluded? You know who best can do a thorough root cause investigation? If they're willing to be honest, if they're going to be ethical, and they're not afraid of what might come, the companies, because they know more about their processes than you do. So let's incentivize and let's create policies that give the companies some credit when they're willing to actually identify what went wrong and help themselves and others prevent it from happening again. And I did that with Boar's Head recently. When Boar's Head came up to me and said, Frank, would you be interested in working with us? If you talk to the president of the company, he'll tell you this to your face. I said, I'm willing to work with you, but a couple things. Know, number one, that I'm not going to be your defense expert witness. If you want somebody to come in and do a root cause investigation, I'm willing to do that, but I'm not a defense expert witness. And you got to give me unvarnished permission to do the work that we have to do. And that company has done an amazing root cause investigation, and they know with certainty what happened, and they've presented it to USDA and other government officials. And guess what? They did on order of 10 times as many samples as federal regulators. That's what I'm going to say. You got to go big. You got to go deep. And they sponged, and they took larger surface areas. The new playbook, I think, if heaven forbid you work in the private sector and you have an outbreak, is number one, get people in that can help. Number two, the company gives you permission to do an unvarnished root cause investigation. And number three, make changes. It's in the public domain. I have a link to their website where I've done a Q&A. They've transitioned all of their products, 100% of their manufactured products, from alternative 3 to alternative 2. And that's what you need, is a good root cause investigation to know what really happened, and then implementation of real corrective actions that will prevent that from happening again. Not to cast names, did that happen in the McDonald's outbreak? No, we got a $100 million marketing campaign. And then lastly, I think it's time for us, once and for all, and you'll see an op-ed coming out from Yiannas on this, it's time for us, two things, to create a single food safety agency, and number two, if we can't do that, we can at least do this, is create something equivalent to the National Transportation Safety Board. You guys know the NTSB? FAA regulates the airline industry. The National Transportation Safety Board is an independent body with 5 members appointed by the president to come in and do the root cause investigations, find out what really happened, and then disseminate that information to the airlines that might have similar airplanes, similar parts, or conduct similar practices. And it's long and behold past time for us to have something equivalent to a National Food Safety Investigation Board. I'll close with a statement that I used a lot when I was in federal service. I mean it today as much as I did when I was at FDA, and it's very appropriate, I think, for an AFDO audience. It doesn't matter where you work. Some of you I know work in the public sector. Some of you work in the private sector. It doesn't matter if you work for a big company or a small company. The challenges are daunting. Alone, there's only so much you can do, but working together, AFDO, and thank you, AFDO, for providing this type of platform. Together, we can do so much. Thank you for listening. Appreciate it.
I'll just tell you a little bit about how this is going to work. So there's going to be 15 minutes at the end for Q&A. So start, writing those down. But we have some questions that we can get started. And I think I'm going to go ahead and start.
Come on up.
Thank you. Perfect. By having each panel member introduce yourself and tell me about the outbreak that it kind of has affected you the most. Not necessarily one that you've been involved with, but one that has really kind of had an emotional effect on you. So let's go ahead and start with Angela.
So I don't know if you guys really want to hear who I am one more time today. I think you've heard just about enough from me, but if some of you missed my name, it's Angela Montalbano, and I work for the New York State Department of Agriculture and Markets. And I've been in food safety, like I told you the other day, I don't know what day it is right now, but when I gave my opening presentation, I told you I started this job in 1990. So I've had countless experiences with foodborne illnesses. Actually, we'll say like mouse droppings, too many to count, right? So, but I think I have to use the boar's head as an example because for me, that really hit home. And simply because there was so much frustration with determining the root cause. And I mean, my own family members were calling me daily. What can I have in the deli? Can I eat anything in the deli? So the lack of consumer confidence, it really upset me. I have a mom, she's 83, she just turned 84, but that happened last year. So I was concerned. Like I told her, do not eat anything from a deli right now, that's it. Because no one really knew. So I would say personally for me, I think that one just really resonated with me as the most recent. I was involved with it as well, so maybe that's also why. But for me, I would say the boar's head was a hit-home type of an outbreak.
That's a great one. Haley, how about you?
Oh, my favorite outbreak. If one can have a favorite outbreak, I'm not sure this one's on. Oh, yeah, there we go. I think it was 2011 listeriosis outbreak from cantaloupe. It was one of our first major national outbreaks associated with produce. I was also an early career faculty member, still a faculty member, I guess, at Purdue University, but was writing my first USDA grant to try to fund my research. And we wrote a grant that was to study produce and fruit and looking at listeria levels in those products, and got feedback from a delightful reviewer that said we were on a witch hunt. And then there was that massive and very deadly listeriosis outbreak from what we believed to be different food sources, and we were trying to actually observe or see if that was actually a fact. So, not that that's how you want to be vindicated
Right.
with your witch hunt statements, but still quite a memorable moment.
And so Haley kind of glossed over the fact that, she's at Purdue, but she has, I had to write down what her role is. She's the vice provost for graduate students and postdoctoral scholars. And so she oversees like 12,000 students.
12,000 graduate students and 600 postdocs.
Which is-
I didn't know I was going to do that, but no.
Yeah,
that's what I did.
super impressive. So Kathleen, how about you?
So I'm Kathleen O'Donnell, and I'm with Wegmans Food Markets. And for those of you who aren't familiar with Wegmans, we're a family-owned and operated regional supermarket chain. So we have 113 stores, and we operate in the Northeast and the Mid-Atlantic states. So, and I think probably one of the outbreaks that resonates most with me is one that happened at Wegmans a number of years ago, and we actively worked with a few different states and a few different locations to get to the root source of the outbreak. It was a salmonella outbreak, and it was attributed to pine nuts, which we sold in our stores.
Yeah, that makes sense. How about you, Frank, in your 38 years, which one has really kind of pulled at your heartstrings?
There's so many that have pulled at my heartstring. Whenever there's a fatality, I mean, it's hard to just pick one. But I can remember in 2019 when I first came into FDA, we were in the midst of a leafy green romaine outbreak, and there was a young boy, many of you have read his story, little Lucas, who traveled from Canada with his family to visit Disneyland theme park. And their mistake was on the way home, they stopped. His father had a salad, and the little boy took a bite of that salad and is alive, but never the same. Brain damage, can't talk, can't walk. And having talked to that family, you just never are the same thereafter.
Yeah, and I think it's just important just to have that emotional connection to these outbreaks, because I think that's what's really going to create the change. In addition to what you were saying, Frank, but as food safety professionals, we have to just remember that they're not numbers; they're people that are affected. So with that in mind, we have this panel that includes, regulatory and academia, and retail, et cetera. So, when you think about some of the things that Frank said in terms of how do we improve coordination between all these different branches, Angela, what do you think? How do we get there?
Well, so I could use that example of Boar's Head, and I did want to say that that one really did resonate with me because 10 people died, and I honestly don't think that anyone should be dying from eating food in the United States at this point in time. I just think it's ridiculous, honestly. I know what's happening, but I think we're missing something, obviously. We're missing the boat somewhere. So back to how do we do this? I think we do work very collaboratively with our agencies. So with Boar's Head, CDC was working with USDA and other states looking at the background of the listeria. And then New York State Health Department contacted New York State Agriculture, and then we contacted USDA, and we did some trace back with them. We took some samples. In the interim, Maryland samples came back positive, and then New York State samples came back positive. And then, I just think that working collaboratively, will help find the problem, but it doesn't help mitigate the problem. So I guess that's a huge question that no one's been able to answer yet. Mm-hmm. But I think I took Frank's food safety culture course a few years ago, and I think that we are all missing food safety culture. So I think that does go down to training and food safety culture, right down to the person that's manufacturing the food or someone in a deli that is missing something. Something's there that's missing. But we need to do our due diligence to help this process along, because we're definitely missing the boat here, because it's continuing to happen.
Yeah. So Frank, what are your thoughts on that, right? You've been in retail, retail and regulatory.
I agree. In New York, thank you. You guys did a great job on that Boar's Head outbreak. And I can tell you what I know about that outbreak. We wouldn't know what occurred there. First of all, the public health system worked, as I tried to show with that epi curve. That could have been an outbreak that would have been much worse. But what I've learned over the years, it really is a team effort, investigating a foodborne outbreak. And oftentimes we think, well, I love the CDC and I love the work they do, but we think it's the federal agencies. We put the CDC, the FDA, USDA up on pedestals. I can tell you these outbreaks would not get solved, they wouldn't get detected if it wasn't for the states. And then when the companies participate in the investigation, they bring in consultants, they bring in third-party labs. When you have the ability to see everybody contributing, that's when those outbreaks get solved the best. So I would just say we need to continue to work together. It is a team effort solving these outbreaks, and no single agency can do it on its own. And I give a lot of deference and credit to the amazing work done by the states across the nation.
Well, thank you for that.
Yeah, 100%. I would agree 100%. So we've talked a little bit about, sometimes the root cause has to do with resources and workforce, et cetera. So Kathleen, I know in retail that has to be a huge mountain that you're facing. So what is your thought in terms of how do we address this in terms of these labor reductions and just so hard to recruit, et cetera, and kind of what the effect that could be on outbreaks?
So at Wegmans, we're really lucky because we don't have the turnover rate that a lot of retailers face. We do have longevity in our full-time workforce, so that's a real bonus for us. But as far as a dynamic workforce goes, we certainly have that because one of the things that we do is we encourage those full-time employees to have different experiences at Wegmans. So if you're someone in the bakery or in the deli and you want to experience something different and work in restaurant foods or work in supply chain or work in manufacturing, we encourage them to do that. So while we have the same workforce, it's very evolutionary because they are doing different tasks. So while we're not starting at ground zero with new employees, we certainly have a lot of employees new to their roles. So one of the things that we really have to take a look at is making sure that what we're doing in each of those roles is a documented process, a documented procedure, that we're able to have that consistency and be able to share that, and that we have training for the right training at the right time. So we rely very heavily or have on computer-based training. And one of the things that we found is it really needs to be supplemented with department-led training. So we need to make sure that you have that person-to-person interaction so that you have that demonstration of knowledge and you know that that individual is understanding. And we have to make sure that we're able to communicate the whys behind what they're doing so that there's that understanding there. And that food safety and that food safety culture needs to be built into the day-to-day of what that employee is doing. It can't be something that they're doing that's in addition to. So it can't be, this is what I do for my day-to-day. Oh, and plus I have to do food safety. It has to be food safety is in that day-to-day and it's just something that's done.
Yeah, absolutely. Haley, did you have anything to add to that?
I just worry that as somebody in academia, they're like, why haven't you taught them something? Right? No, and so as someone who had the pleasure of teaching sanitation for 13 straight years, I just reminded my students, I said, this is not going to be the sexiest class you've ever taken. And it might be not the hardest class you've ever taken, but it might be the one that keeps you out of jail. And now it's going to be very classroom-based. What they don't have is that field experience. And I'm curious, my hypothesis as we look at the cadence of outbreaks and listeria coming back in deli meats, I agree why. I'm wondering if it's about a 20-year cycle where we have workforce turnover. And you have my new crop of students, I'm sorry in advance for a lot of reasons. But you come in and you have less experience. And does the training model work? Is that knowledge transfer there? The seek and destroy model was very much a thing in the early 2000s, was very effective for the meat industry, but is it good for now? Did part of that die? I don't know.
Yep.
But it seems very curious that we see these cycles. The organism isn't new. The product's not terribly new. So I'm curious.
Can I build on that? Because this is such a rich conversation, audience. I hope you're feeling the same thing. We are seeing a lot of turnover. I do think we're losing some knowledge people that are leaving, and you've got new people coming in. We also have increased at-risk population. The population 65 older is booming. This Boar's Head outbreak, the median age, does anybody know what was the median age? 78. Wow. 78.
Well, those are the people that eat liverwurst.
Liverwurst.
I like liverwurst. I really like liverwurst.
Sorry. Hope you guys don't.
Now she's picking on liverwurst.
I'm pre-gaming.
They're going to throw tomatoes at me. Oh, wait. Is there salmonella in the tomato? Wait a minute.
But we are seeing an increase. But I don't disagree. I mean, we have to do it all, right? We have to continue to give employees the knowledge and skill. We have to build cultures in these organizations so they're doing the right thing, not because they're afraid they're going to get caught, because they care. But I do want you guys to spend some time thinking, because I'm convinced now after 38 years, and it isn't a cop-out, that we need to transition away from administrative controls and start adopting engineering controls. And if you look at the advancements that have been made in so many other domains, you know, whether it's the airline industry, attractions industry, you engineer risk out. You just have to do that. And so that doesn't mean we're not going to rely on trained pilots in the cockpits of those planes, but we need to do some more engineering. And I do think we have a chance in front of us over the next 5 or 10 years as we go this wave of automation, because we're going to try to tackle labor challenges. We either will get it right or we'll get it terribly wrong. Make sure you have a seat at the table.
So let me ask you this, Frank. So how do we get some of those engineering fixes into these very small businesses?
Well, you know, I'll look to the academicians here. I don't know that we do a lot of training on proper hygienic design. And I feel like the industry is just really lacking expertise in this area. I know at Boars Head, one of the things we did is we went out and got a director of sanitation that just, when he comes in, the way he looks at things is very different than somebody, Yiannas, that's been doing it for 38 years. He understands sanitary design and automation a lot more than us. So I do think we have to provide that type of skill set to the people working on food safety, and maybe we're not all going to be sanitation and hygiene design specialists, but we need to have a general awareness, and we need specialists in this domain.
So we just learned last week, Steve had shared with us that there's a training entity out there that trains their carpenters to learn how to, if there's construction happening or something needs to be corrected in their facility, they train the carpenters how to designate an area, rope it off, make it clear from any contaminants. So I didn't know that. I mean, I just learned that. So that sounds like a great business. Whoever's looking to retire, it sounds like a really great opportunity. Since we're hearing the word opportunity all week, it sounds like that's a great opportunity, an engineering process to minimize this problem.
So let me turn it over to another root cause that frequently, as your presentation talked about, right? You know, the pathogens. So Haley, I know you've done a lot of work on EMP programs and how to, you know, use those EMP programs to you know, these longitudinal studies to predict. Can you tell us a little bit about what your studies have been and what we can learn from them?
Sure. Starting in 2010, so right out of graduate school, and starting at Purdue, my lab started looking at Listeria monocytogenes and other Listeria species in retail grocery stores. Because the motivation for that was really a risk assessment that said, yes, listeriosis cases have gone down, but those that remain appear to be, or at least are attributed to that deli meat that's sliced at retail. So we wanted to take a look at that environment. And as we looked in an initial study of 30 stores, which bloomed over the next, 10, 15,
number of years.
5,000 years later, about 150 stores across the U.S., it got to the point where we had enough experience where we could walk into a retail grocery store that I don't need to test for Listeria. And it's not like I have magic glasses where I can find Listeria. It's not that special. But really just looking at the environmental conditions that are going to be propagating or supporting the growth of Listeria should it be introduced into that environment. So some pretty basic stuff. If I see standing water, if I see water near a drain and a squeegee, we're pretty much going to have Listeria monocytogenes. It's almost, it feels like a guarantee in many of those instances. But we also were seeing, as again, you spend enough time in these stores, we drive to most of them, or we're physically on site and engaging with people in those stores and with the community around it. And we also started to notice that some of our stores where we had the largest challenges, or like a lot of listeria and listeria over time, so a persistent contamination event. I was noticing that these seem to be in some socioeconomically curious, I would say, locations. So if it was a poorer part of town, like pretty darn evident as you look around, the infrastructure, the streets, the infrastructure of the store, the amount of produce or really lack of produce, for example, in those stores because of what the economic buying power of the region, of the area would be, there was a higher likelihood I was seeing in those stores of finding Listeria monocytogenes. And so I worked with an economist, as one does. A friend of mine say, all right, what data do we have where we could take, here's my years of Listeria data, what other data do we have where we could take a look at some of these outside or other drivers? And so we used 2010 census, US Census tract data to actually overlay that with the zip codes of where those retail stores were. All of this was blinded, has always remained that way. But sure enough, there was a positive association of a higher likelihood of finding Listeria monocytogenes in stores in the lowest income quartile. And so what does that say to me? I mean, you can use the word environmental justice if you want to, but what it says is we probably have a higher risk population being exposed to a really potentially dangerous pathogen. And why is that? Well, those stores are probably lower margin. There's less incentive to reinvest in the infrastructure of those stores. You might have more cracks. You have drains that aren't draining or more of that standing water. And so it's an unfortunate negative feedback loop. So that was kind of the end of our study. It took us 15 years to come to that conclusion of I don't always have to test for Listeria. We can usually see the conditions in an environment that would predict whether it'll be there.
And my guess is, Angela, in your experience, that you've seen those same conditions and could, perhaps not know that there's Listeria there, but say, yep, that's what I see when I go out.
Yeah, I mean, and so I started my career in Brooklyn and in some areas with socioeconomic issues, and I mean, you could guarantee that there would be a problem someplace, but we didn't look for it. So if I did, I'm sure I'd find it, and if they do, they would find it. But we can't, and it goes right back to resources. If I could swab every single deli, I'd find it. I would. I don't know. I can't guess. You
at least 30% of them.
Okay, so thank you for that. I'm not a scientist here.
I'll fill in the gaps. I'm here for you. 30%.
30%. And I mean, it's just amazing. But we don't have the resource, unfortunately, to go and analyze every store we're in. But and that's in retail. So in manufacturing, we rely heavily on the manufacturers to do their own sanitation, environmental testing. But are they seeking for that? Like, are they looking?
We can design a program where you find nothing.
Let me just build on that, because part of this is taking that great research, and thank you, Haley, for doing it. And I think Martin Weidman did some similar work, and based on the work that you did and he did, and you might have done it together, I mean, it should inform action by the industry. And what we did is, at that time I was working for a large retailer. We sent letters to all of our suppliers and said, we want you to reformulate your deli meats to have an inhibitor in them. Because, well, we were going to try to maintain a clean and sanitary deli environment. We just assumed some Listeria might get in there. And so that kind of research gets out of the research journal, but it has to be applied in the real world.
Well, and that was going to be my follow-up question, right, for Kathleen and for you, Frank, from the Walmart side, if there's a deli counter or whatever, and Kathleen, deli counters for yours, is that representative of what you've seen at those stores? If you have some of those indicators,
100%.
are those the stores that you have to focus on?
100%.
So when those are the stores, and I mean, we operate stores of various vintages. So you have some stores that are very modern, and some stores that are a little bit older and built without as much sanitary design into that process. But those are the ones that you typically have to focus on.
Okay.
I keep waiting, Kathleen. I've waited 15 years for Wegmans to come to Indiana.
We're as far west as Erie, Pennsylvania.
You're getting there.
I just got one in Long Island. You'll be waiting another 15 years.
I know. It's so sad.
So here's a great question that I think a lot of you are going to want to answer. So what's one lesson from a past outbreak that, from your perspective, from the state of New York, or academia or retail, or Frank, your 38 years, that So one lesson from a past outbreak that you've seen successfully turn into a lasting change.
That's a really big question.
Right? I mean, because when we're talking about, what are we learning so that we can get better in the future? So what have you seen, Frank, you can start with you. In your 38 years, has there been something that you said, okay, this one worked and it has made this?
Well, like I said, you just can't keep on doing the same outbreak investigations on the same food vehicles and not make a change, whether it's the private sector standing up and leading by making process improvements or the regulatory community saying it's time to have regulations. And the one that probably jumps out at me is one of the best success stories I can't take credit for, but we need to thank Mike Taylor, Jack in the Box.
Yeah.
Does E. coli still get into ground beef? Yes. But are we seeing a lot less cases of E. coli due to hamburgers? Yes. And so Mr. Taylor had the courage to work Capitol Hill and declare 0157H7, much to the moaning and groaning of the industry, an adulterant and zero tolerance pathogen. And the industry started making changes, steam pasteurization of carcasses, and 60 sampling plans. Fast food chains started cooking their beef patties to 155. And so that's an example where we said, it's not good enough. Unfortunately, that took deaths among children to motivate and cause outrage. But we should be motivated, and we should have similar outrage with a lot of the recurring outbreaks that we're seeing.
Yeah. Does anyone else have one?
So,
Kathleen?
and while we do see these reoccurring outbreaks, one thing that we found that we had to do is for leafy greens, we had to develop a specification with some really strict criteria so that we could hopefully move forward and not be involved at all in any of the leafy green outbreaks.
I don't know that I'd say a specific outbreak, but a point really that Frank had made earlier on technology. I feel extremely fortunate to have gone to undergrad and graduate school in a space and time where we did actually the application of whole genome sequencing, and then to see and be an active part of that development as a tool, and then to see it launch into practice, and now seeing it actually, reside in the private sector. I mean, I think having that kind of tool is really important. There's more tools to come. I'm excited to see what those will be until we can get past this enrichment step of, we still have to have 10,000 cells or so in order to say we have an organism there. So to take that 1 to 2 to 4 to 6, 8, that takes time, and time is money. So until we can overcome that major technology hurdle, we're stuck a little bit. But again, I think it's a privilege to be able to have experienced the whole genome sequencing development and to see that come into practice, and how impactful it can be and how many lives it actually can save by saying we have a problem sooner.
I mean, I think we just still have this big problem. I'm not seeing where we've had major movement forward in stopping this from happening. So I think that internally we've made strides internally with our communications, and our lab is standardized and accredited to do the genome sequencing, and they help us quickly identify. But I just don't think we're there to be able to answer that question, saying what strides have we made for an outbreak? We're just waiting for the next one to happen, which is not a good thing to say.
Right, right.
And I don't want to be negative Nilly here, but I just feel like we're just waiting for truly, right? Like you wait till tonight, there might be another one. And they always happen on Fridays. I know that's the joke of the hour here, but that is when they happen, on a Friday.
Yeah.
It's by the time it gets analyzed, right? Friday, the result comes out. So
That's when you know.
I don't know. I don't want to sound negative, but.
But I really like what you're saying, and we're going to be wrapping up in a couple minutes now so we can do Q&A. But Haley, I like what you're saying, that the whole genome sequence is kind of where we are. So my next question is what gives you hope for the future, that we can get better? And I know, Frank, you said we're not going to meet 2030, but can we meet 2040?
Yes,
so
we can.
So what do we
Yes,
have
we
to do
can.
to meet 2040? So in just a sentence or two. Who wants to go first?
I think it's training. So I truly believe that we need to train all employees active managerial control needs to be in place. We're in New York State, we're adopting the 22 food code, so that is requiring food safety training. And I will tell you, when I first started my job, I used to say, don't they have to have training for food safety to prepare food? And they didn't. So finally they do. But so I think that it just goes back to training, constant battling of training, and then food safety culture will help that process along.
Okay. How about you, Haley? What gives you
I
hope?
was like, what gives me that nobody likes diarrhea?
True.
I mean, nobody likes that. And as somebody who makes poor food choices and, takes myself out occasionally, because I still like oysters, even though I have an understanding of what just happened 12 to 24 hours later.
Yeah.
Why are you sweating and on the floor? I know why. But I don't like that. And so I haven't eaten oysters for a few weeks because I'm like, that was a bad choice. That we do learn, and we remember why. And I'm not the most optimistic at the moment, because as somebody who's dependent, or whose system and students and next generation are dependent on some federal grants, that if you want to move the needle in science, you're going to have to fund it. And that's not unique to food safety. And I think the demand for that will come back, and I think it will remain strong.
Kathleen, what do you think?
So, and I think I want to get back to one of the points that Frank really made earlier today, and that was really on getting to that root cause evaluation and getting to that true root cause, and being able to look at those hypotheses and test those hypotheses. And if we know what happens, we're better able to not do that again.
Yeah, I'm optimistic. I don't think we'll make 2030, but I do believe we'll make 2040. And I do believe we'll bend the curve of foodborne illnesses. There's so much to be optimistic about in the long run. I agree. I think just how the science is evolving, there's three big trends that have me really bullish. All the advancements that we're making in genomics. WGS is wonderful. Industry's adopting it. There's a whole new wave of genomics. These isolates or bugs don't exist in pure form. So with metagenomics, we'll learn more. I think the whole revolution we're going to see in automation will be good for food safety if we get these things right. And the whole revolution that we're seeing in information technology, better data and insights. And so, but even with all the science, it requires people. I always said smarter food safety is people-led, science-based, and technology-enabled. But we need all of you out there to not just be public health managers, food safety managers. We need to all be food safety leaders.
Okay, perfect. So with that, let's open it up to the audience. If you have questions, we have people with mics running around. So who wants to go first?
This is mostly for Frank. You mentioned murder mysteries and that there would be value in like an NTSB for food safety or for outbreak investigation. What do you think about a cold case detectives for outbreak investigations where there was no root cause found? Like going back and digging through and seeing if they can find anything, even though...
We have. I mean, there have been outbreaks solved that are cold cases. I think the original Bluebell outbreak was cold case, wasn't it? It was CDC was in a laboratory safety mode, taking isolates, actually conducting sequences. Lo and behold, and they found some cases that said, hey, we've seen cases like this in the past. So I do think today, because of WGS, we do solve outbreaks retrospectively. When I was at the agency, I remember one time found salmonella in shrimp. And it was the shrimp isolate, the sequence of the shrimp isolate, that we started just looking at the human cases that we said, hey, we've got some salmonella cases that we've never solved. So I think we do have the capability of solving cold cases today, thankfully due to WGS. So we should use tools to be able to solve cold cases like that. But I do think the National Transportation Safety Board model is a different model. Folks at CDC have been talking about this thing for years. I just think it's time for us to get serious about it, because when these outbreaks happen, yeah, I love the regulatory agencies that investigated CDC, the FDA, and USDA, but they're never going to be critical of themselves. I can tell you that. We're never going to be critical of how we handled infant formula. USDA is never going to be critical on how they're handling beef. And that's why you need an independent organization like the National Transportation Safety Board that has men and women. Some of them, if you look at the members, some of them have worked in the private sector, some of them have worked in government, but just the smartest thinkers in and outside of government to say, go investigate. And you can't do it for all the outbreaks. We have too many, but some of the big ones, I think it would be a good model to use.
I would add to it, I probably wouldn't focus my resources that direction just because of other missing data, such as on the epidemiology side. If you don't have it, you might put yourself in a position where you over-conclude or make the wrong conclusion. And I wouldn't want to muddy those waters, like a food that truly wasn't associated with that. I'd want to put my resources in the forecast.
So Don Schaffner, Rutgers University. I guess this is probably a question for Haley, but I'd be happy to hear feedback from anybody.
Good to see you.
As you folks were talking, I was thinking about the Jensen Farms outbreak. And a lot of things went wrong at Jensen Farms, but one of the fundamental things that went wrong was that they were trying to clean the cantaloupes. And if they hadn't cleaned the cantaloupes, we would have dirty cantaloupes, but maybe fewer listeria cases. And that reminded me of another presentation that I heard many years ago, and I don't ask for the citation or the conference, but it was something around in a manufacturing plant where the company had done a really good job of getting rid of listeria species. And once they did that, they got a resident strain of monocytogenes. And so these two questions are related, and you could maybe summarize them as like, are we trying too hard to get things too clean? And is there something to be said for maybe not doing that, or is there any way that it would be, if we could establish a resident strain of listeria, non-pathogenic listeria in a plant to exclude the monocytogenes? Is that just a pipe dream? Am I making any sense? I'll stop now.
Good to see you, Don. The question, I think, the question is, can we use like a competitive exclusion type model? Can we put somebody there that we want there as a mechanism to run the bad guy out of town? I don't have a lot of confidence in my response to that. I don't know, Don. I think it's going to be so situationally dependent. As we try to understand, you're in the same business, but of using the tools of whole genome sequencing, we are still noodling in this space of, we had grocery stores where we had listeria and where we didn't have listeria, and then we have now environmental samples to look at that, to look at the flora or the organisms that are there. We're still mid-process on that to see, can we tease out, is there somebody who can hold down the fort, and keep, some of those other organisms out? It's still underway. I'll call it fully an exploratory study. I don't have a major outcome or full-blown hypothesis of what it will be. But really, let's see. We have the data, we have the environment and the opportunity. So I guess the answer is TBD. Very unsatisfying, I'm sorry. Very academic, right? Well, comma, is how every response starts.
Hi, thank you. You mentioned re-engineering as one of the solutions going forward. With that in mind, is there a thought to, you mentioned a neutral third-party agency, of creating a criteria to certify equipment before it's resold? I know there's instances where people will sell equipment that was problematic, or maybe even, get rid of it, and then it becomes a problem in another facility. So if I'm one of those companies that are re-engineering, I'm going to probably sell everything I have. So is there forethought to prevent this from just going down a level and then down a level as people sell off their equipment, to have foresight to make sure the equipment that is certified free of listeria and other bacteria before it's resold?
That's for you, Frank.
Yeah, it's a great thought, because I do think we're going to see more of that in the future. As people, it takes money to reinvest. But, we did have groups like NSF certifying the sanitation and cleanability of equipment. I don't know of a group that does that for used equipment and reselling. And if you think of the question that Don just asked, yeah, they were trying to wash, but what did they buy? An old potato washer. So we have real world examples where buying a piece of equipment to try to do the right thing actually causes harm. But we ought to think about trying to create process like that. I think in the short term, We just need industry to be aware. If you're buying a used piece of equipment, you ought to have some knowledge and you ought to do some due diligence before you buy the equipment.
So I think the industry is aware. I mean, many times I was a manufactured food inspector, and I think the industry is aware of that. Like, I'm sure you can attest, right?
Yeah, absolutely.
So you would know, and we do as inspectors, we tell them, oh, this is a new piece of equipment. Oh, have you tested it? Do you make sure that it's clean, free of pathogens? And they virtually typically do this. I see a bigger issue with the retail end, because there are so many retail facilities out there that do not have the same level of controls in place to manage the risk. So I mean, for me, I see retail as a higher risk facility than the larger manufacturer.
I think there was another question over here.
Hi. So food safety culture, it's a phrase that's become way more popular, I think, over the last decade, and something that is inherently hard to put into every facility, especially when you consider there are a lot of facilities that don't have the financial power to really incentivize food safety. And when I take these food handler trainings just to see what's out there, it's hard. I can't say that I see a lot of that food culture present in these trainings. And I think there's that inherent challenge of trying to explain the whys and the science behind things when we have this varied level of education in especially just retail food industry is what I can speak to. So do the panelists have any recommendations for other ways to incorporate food culture, or ways that we can start maybe demanding more of a change within the training opportunities that exist to incorporate food culture?
So Frank is the guru for food safety culture. Before I let you
Please.
before I let you take that.
It's a tough question.
Well, yeah, I can't answer that question. I'm just giving you a little insight. I can't answer that question. So I work a lot with the national curriculum standards for training, and for years, I mean, I think it's been going on for like 15 years now, that we've been working on competency-based for different program areas. And only recently did food safety culture enter this world of joining our group of competencies. So that will be happening in the future. So I know that doesn't help you now, which is where Frank comes into play.
Yeah, I'm happy to try to answer that. Thank you for acknowledging the importance of it. You know, oftentimes people have heard me talk about this, and I've written a book on the topic. People often say, well, that culture stuff, it's the soft stuff. And I've been criticized at talking about it at IFP annual meetings, and it's because I concluded working with large organizations, 2 million large, it's the soft stuff that's the hard stuff. I could write great HACCP plans, I can write great procedures, we can inspect the heck out of them. But I do think it's become a little bit kind of vogue, and people say it without really thinking about it. When I teach and write about food safety culture, I use a model that begins with, you know, making sure that the organization has food safety linked to their values and beliefs, that there's expectations clearly defined. I use a model that identifies the importance of training and education in a way that influences human behavior, but I also talk about communication, measurements. So I don't think we're going to create a food safety culture with training and education alone. But having stated that, I wish that trainers and educators, and I always say there's a difference between training and education, I wish they knew a little bit more about proven behavioral science principles. Because knowledge doesn't equal behavior change. And what we do is regurgitate knowledge at people and think that that's going to influence their behaviors. And so I think a good place to start, if we're focusing on the core element of the role of training and education in culture, it's not going to create a culture alone. Let's at least do training and education, not just to meet a regulatory requirement, not simply to impart skills and knowledge, but in a way that better influences human behavior. And I don't think you can do that if you don't have insights into human behavior.
I mean, and we have to practice it ourselves in order to teach it when we're inspecting, right? I mean, if you're speaking to the manager or the employee, you have to instill your own. I mean, when you go home, you have your own culture about food safety, right? So, I mean, that's what I did as an inspector. I would I would portray that to the facility. Whether they would practice that or not, that's another story. And that's part of the problem. I don't think they have that foundation, and that's why I think we have a problem and a continual struggle. I don't think that's there strong enough that continues and safeguards as we move on.
I have a question for you, Frank, or for others here. Just the way you phrased your question, does the word culture have a branding issue? And is there a better word to better capture what we're actually trying to achieve here?
I actually don't think it has a branding issue. I think it has an understanding issue. And, I often say, if you look at the major catastrophic events that happen in society, and when we put the smartest men and women together to investigate those, the government will put panels together, whether it was the BP oil spill, the General Motors or ignition switch failures, shuttle disasters, most recent NASA. What do all those panels of sometimes they're mechanical engineers, electrical engineers, what do those panels always conclude? It's a culture of that organization that allowed it to happen. And if you know the definition of culture, it's shared values and beliefs kind of govern the behaviors of people that work in a company or an organization. So I don't think it's the word culture. I think it's our understanding of what it is. And we've got to get away from what I call bubblegum food safety culture, which we just think it's rah-rah, pom-pom food safety culture, and really understand the organizational dynamic and behavioral science principles on how do you drive that change.
Hopefully that got to you. Any other questions out there?
One more.
Over here.
I'm very naive, so I need some hope here. I need to leave this room with some hope. So we've all heard the stats that 48 million people, Americans, get sick every year. So that's 1 in 6 people. So can we take some credit for the 5 and 6 that are staying safe and protected? Can we say that industry, academia, regulators are doing the right thing? And I'm asking because I need to go to my state legislatures to ask for money and saying, because we've been doing some good work in the state of Washington, can you give us more money to keep people continuing to be safe because of what we do?
That is a great question, Louisa. Who here can answer that? 'Cause I think you're absolutely right. We have to say, what have we done? And absolutely, there's still work to do. But how do we phrase that? Who wants to grab that one?
I suppose we could reverse engineer some of these studies and do some what ifs. Like, what if whole genome sequencing didn't slow down that outbreak? You could probably, this is more Dawn's probably area, and some modeling of forecasting how it could have been worse. And that's not a, you're right, that's a sexy paper title. It could have been worse. But, but how do you show that, right? I mean, I think it still is impressive. I think we still get to declare we have a very safe food supply. If I would quit making poor choices like oysters, we'd have less foodborne illness. But we could forecast that.
But it's a fair comment. So listen, I can't tell you, when I was at FDA, I worked for 6 different commissioners in 5 years. That was a revolving door. If you had 6 CEOs in the private sector, your company was going out of business. But every time I had a commissioner go testify in front of Congress, they'd always want to say, we have the safest food system in the world. And I'd always take the word edit section and say, we have among the safest food systems.
That's why I said safe, not safe. I left the EST off. I don't want that liability.
But the challenge that you're talking about, I do think we have to take credit. By and large, look, I use leafy greens as the example of the outbreak that hit me the most, but pause to think about it. There are 150 million servings of fresh leafy greens consumed safely every day. Now, having stated that, I hear you. I don't think it's your best way to try to get funding from your state legislature. I've tried it. It's called the anonymity of prevention. I told my boss at Walmart, at my annual review, I said, listen, I prevented 3 outbreaks this year that would have devastated the brand. I think I deserve a raise. And she said, how do you know? How do you prove them that you prevented it? So I do think there's a way to frame it that by and large the food system is safe, but one outbreak in your state, one outbreak in one of your regulated establishments would be devastating. And use those stories of the tragic consequences that have resulted to others to try to continue to get funding. I just don't think, working in government that just saying our food system is safe, but we need you to continue to fund works.
think I would add that the technology that we keep layering in actually helps us understand more outbreaks, and it may seem as though things are worse, or we just didn't know what else was going on in the background. And so people ask, oh, it seems like there's just so much more foodborne illness. No, we have a better understanding of how much more foodborne illness there is, and I think balancing that part of the narrative is also important.
But I do know this, it would be a lot worse if it wasn't for each and every one of you. And I mean that very sincerely.
And I love that. So on that positive note, we will end. And so I'm going to thank Carrie Rignan. She got us all together. And I'm going to thank our panelists for being willing to come up here and have that conversation.